Hey, in the essence of time, we will go ahead and get started. Welcome, everyone, to our October Be Well Lunch and Learn titled Ergonomics Safety Training. So excited to have Andre Thomas with us from the Penn State Health and Safety team, where he is a program manager. Before I pass this over to him, just two reminders. The first being that we do record these, so if you can't stay for the entire session or would just like to revisit it at another time, we will send out the recording and a copy of the slides in a follow-up email within the next few days. And then second, if you have any questions or comments throughout, we will address all those at the end and we'll get to as many as time allows for. So with this, Andre, thank you for joining us today. I will pass this over to you.
All right. Thank you so much, Angela. Hi, everyone. Thank you for attending today's ergonomics safety training. Today, I wanted to just discuss what the ergonomics safety program is, what essentially we're trying to do, and kind of how to contact us. My email is listed right here. The phone number is the safety department phone number. If you're looking for an ergonomic assessment, you can email me or you can call and just let the person who picks up, it'll be most likely Colette, our administrator, and just let her know that information. So what I wanted to talk about today is ergonomics in the workplace, because it's not something that's really discussed as much as it should be. Although it's something that does pose a lot of risk and hazards in the workplace, and as a matter of fact, is one of the leading causes of injuries in the workplace that we end up seeing and are actively seeing across Penn State Health and all other industries. But a few of the things that we tend to look for when we're doing ergonomic assessments, and that can cause these type of injuries are repetitive motions, tasks that involve repetitive movements. If you're pipetting, if you're working in a lab and you're pipetting or you're using a microscope, or if you're working in an office and you're making routine calls, just picking up the phone and hanging it up routinely, that repeated motion can cause strain to your muscles and joints. Sorry, just getting over a cold. Awkward posture. So a lot of times we don't really think about it. We're so used to how we sit and how we work. A lot of us sit hunched over because it's easier for us to see. And it's, over time it becomes more comfortable. We're used to sitting hunched over. We're used to sitting like this, but not really noticing that that position over time starts affecting your muscles, your joints, and how you're feeling, and it will cause strain to your body. Acts like bending and twisting as well. It can be chronic or acute, it can meaning it can happen over an extended period of time, or it can happen right away. Like one quick twist and you pull something, can happen very easily. It can happen over time. Lifting and carrying. This one is a very common one. Employees get injured all the time when they're doing heavy lifting, or they're handling equipment. Happens very, very commonly. One of the main injuries that we are seeing across Penn State Health. And computer use, extensive computer use, using it throughout the day. For the most part, a lot of us do. A lot of us work in front of our computer, and don't really think too much of it. But again, when you're sitting in front of a computer, it does encourage a lot of those other things that can cause those injuries, those ergonomic type injuries. If you're sitting in front of your computer, potentially you have that awkward posture. You have that repetitive motion of reaching left and right to grab different things. And also just the way the computer is set up can also, be successful, or it can lead to ergonomic injuries or pain and discomfort. So we want to mitigate these hazards, and in order to do so, we implemented guidelines, best practices, we conduct assessments, and we provide training to try to reduce, because elimination is the goal, but it's not always practical. So we want to reduce the risk of these injuries. And these are known as musculoskeletal injuries, injuries of the muscles, nerves, tendons, and ligaments. They tend to be the leading cause of injury across the healthcare industry. As I mentioned before, we're seeing it here in Penn State Health, and a lot of these can include sprains, strains, tears, herniated disc, numbness, swelling, and mainly across healthcare industries, what we're seeing is sprains and strains. A lot of those due to that heavy lifting is what is affecting most employees. So symptoms of musculoskeletal disorders that you may notice while you're actively working, an indicator for you that something isn't right. My setup isn't right. The way I'm working needs to be adjusted. If you experience any sort of pain, tingling, cramping, or stiffness in any part of your body, your arms, shoulders, your back, your neck, legs as well. If you notice any sort of burning or discomfort when you're moving, any dull or aching feeling, don't ignore it, don't disregard it. That could be a sign that you either have a musculoskeletal injury or you're likely to get one shortly. So if you do notice that, you want to identify, you want to stop what you're doing, and then contact safety. We can work with you to address the setup, see if there's anything in that setup that could be leading to these injuries, leading to this pain, discomfort, any of this feeling that you're having. Because a lot of the time, when we do these assessments, we're noticing that the way the workstation is set up or the way the employee is working, it correlates with the injury or the discomfort that they're feeling either in their neck, shoulders, or lower back. So, principles of mo body mechanics. It's a training that's in development right now, because healthcare workers are at risk of injury, specifically when they're performing tasks like moving patients or performing any sort of manual lifting. So for principles of body mechanics, they kind of walk you through the different transfer methods for transferring patients, the different type of equipment that you can use when transferring a patient, kind of just the way you want your center of gravity to be. So that is a training that is currently being developed. I believe it's currently being finalized, and I'm sure that it'll be communicated across the system when it is available. So if you do work with patients, I strongly recommend that that is a training that you take. And as I mentioned before, um, ergonomic injuries, musculoskeletal injuries are becoming one of our most common injuries that we are seeing in Penn State Health. In 2024, it was um, our top third injury. So far this year, it's still at top third, but we are seeing every month that we are getting an increase in strain injuries, not just in one location, but across the entire system. So a couple things that we can do to prevent this are we implement these administrative controls. We provide guidance and training like this one that we are taking right now. If you're lifting heavy loads or heavy equipment, use two people to lift that equipment to reduce the amount of force that you're exerting. Um, if you have repetitive task that's done among like the same staff, rotating task, or even among yourself, just rotate the task from what you're doing, kind of change up your routine a little bit to avoid that repetitive motion. Look for ways to improve the task if you notice that it feels uncomfortable, the way you're sitting or where you're standing or the location, based off of like your posture. Try to figure out a way to find a posture that's going to be more comfortable. Try to find a way to reduce the repetitive motion. Try to find a way to reduce how much energy you're exerting, how much burden you're placing on your body. If possible, use equipment and use tools to lighten that burden. Um, and as I mentioned before, if you have multiple employees on a team that kind of perform the same task, uh, give each other periodic breaks. Kind of rotate between who's doing the task. That way, you're not doing the same thing over and over. It doesn't seem like much, but reducing even by like half it is a significant increase onto this how much you're relieving your body of that strain. And if you're using tools, make sure that they're properly maintained, because if they're not maintained, they're going to cause you to exert extra force, which the tool is technically designed to prevent. So I mentioned that strains are something that happen commonly because we're lifting heavy objects, and that's true. That does happen very frequently across Penn State Health. So a couple things to keep in mind when you're going to lift an object. One, you want to warm up and stretch. This is going to reduce the risk of injury while lifting. It'll loosen up the muscles. It'll loosen up the stiffness in your body so that when you are lifting, your body isn't tight. It's less likely that you're going to pull something while doing so. Um, if it's a large object, and you're not going to be able to see over it, use two people to move said object. Ideally, you maybe want to place it on a cart, but have another person there to help you lift the object. That way, someone is also able to see as well. And when you're placing the object down, you want to make sure that you're using the same technique that you use to lift the object up. Which is going to be, you want to make sure that you're always planning your lift, checking, make sure you have a clear walking path from where you are to where you're going to go with the object. You want to make sure you're facing forward, never bending your neck, keep your back straight. Make sure you're always bending at your knees. I feel like we've all heard this a lot, but bend at your knees, get a good grip, and make sure you're keeping your feet shoulder width apart. Next, I wanted to just play a quick video to kind of just demonstrate. This is from the University of California. And at the end, they do say, if you have any questions, call the University of California Contact Safety Department here at Penn State. But
Know how to live safely? The three principles of safe work are keep the back straight, keep the load close, and avoid twisting. Implementing these three principles will help keep you safe while you perform all tasks, including lifting, whether you're at home, at school, or at work. To perform a load lift, assume a wide stance for stability. This allows the load to be directly under your center of gravity, which keeps the load close. Because the arms work most efficiently when the upper arm is maintained close to the torso, this also reduces physical stress on the shoulder. Test the load. Before lifting, get your head up to establish a safe posture of the spine with your back straight. Lift vertically, like an elevator, using your legs. The stance of the legs can be squared or staggered because both are balanced and powerful. Use the stance of your preference for the one that keeps the load closest to your center of gravity.
Transferring loads from one location to another, like moving hazardous waste containers from a shelf to a cart, often presents a risk of twisting. Twisting, when combined with compressive force, can cause injury to the discs in the spine. Here we see an example of a worker using unsafe technique. He bends at the waist, rotates the torso, and reaches to access the box on the low shelf. He lifts like a crane with a rounded back while reaching and twisting. This is a risky way to lift.
Here's a less risky alternative. To avoid twisting, move your feet or pivot. Face the load with your hips and torso in the same direction. Kneel and pull the box off the shelf, shifting your center of gravity while keeping the back straight. Once the load is off the shelf, use the lift option of your choice while keeping the head up and the back straight.
To minimize physical stress on the body when lifting at home, at school, or in the workplace, remember to keep your back straight, keep the load close, and avoid twisting. For more information, contact your University of California.
Right. So that's essentially the step you want to follow when you are lifting any sort of object, whether it be heavy or not so heavy, heavy or light. You want to make sure that you're bending properly, that you're keeping your back straight, you're facing forward when you're lifting and when you're putting the item back down. Okay. Whenever possible, try to use a cart to transfer heavy items. If one isn't available, having two people transfer to reduce the amount of strain you're putting on your body is ideal. But if you have a cart on wheels, that's going to be the best thing possible. You never want to try to carry any heavy items, such as boxes or bags over your shoulders is something we see commonly. It's very heavy and uncomfortable, so we kind of just like hold it on our shoulder. It feels a little more sturdy, or feels like we have a better grip, but it places a significant more strain on your body than actually holding it. This picture was taken in comparative medicine. This is an example of the cart that they use to transport bedding and feed across the facility. Um, Feed and bedding can weigh between like 33 to 40 pounds. So instead of having to carry these heavy bags or boxes, they just put it on a cart and transport it. And that's what I highly recommend. And with carts and items like that, they are gonna stack up in how heavy they are, of course, because you're placing a heavy object on them. So one thing you want to remember is that with carts or other objects, you want to make sure that you're pushing instead of pulling. It's going to be significantly easier to push the object, to push the cart than to pull it. It's also going to place less stress. It's going to place less stress on your shoulders and on your back. And just keep in mind, it takes less energy to keep an object moving than it is to stop and start it again. So just by pushing it, it's going to gain that momentum. You're not going to have to, if you're pulling, you're going to have to keep making those stops and just keep pulling again, exerting yourself. You're pushing it, you're just going to kind of follow the momentum, and that's what you want to do. And then just kind of another thing is if you're pushing it instead of pulling it, you're very less likely, or much less likely, to roll over your own feet with those wheels. It's happened numerous times. You want to make sure that you're avoiding overexerting yourself and these repetitive motions, as they can be primary causes for musculoskeletal disorders across all industry. If the task is very repetitive, try to rotate the task every 20 or 30 minutes or so. Try to find a different task to do. That way you're not just constantly doing the same thing over and over, not working those same muscles. Do something else. And it could still be productive. You could still do a different role assigned to the job, but it doesn't necessarily have to be that same motion. Give yourself a break, give your body a break. When we do feel that pain, that discomfort, that's our body saying it needs a break. And then just every 20 to 30 minutes, just take a moment, stop and stretch. It doesn't take more than 30 seconds to do so. And as I mentioned before, especially with awkward postures, try to find those different positions for comfort. And if you experience any sort of pain, you want to make sure you stop immediately. Overreaching and extending, that's also going to place strain on your body. You're trying to reach to an area that you may not be able to access. That's going to start causing strain on your shoulders and on your neck. One easy fix to this is we recommend using step ladders. They can be made available. Granted, they cannot be any more than like creating more than like a 4-foot distance from the floor, because then that's also going to create another risk or another hazard, a fall risk there. But step ladders can be made available to access those hard to reach areas and reduce that demand that you're putting on your body and on your muscles to extend and reach that said object. That's right. Set yourself up for success. Use devices to lift and reposition objects, such as carts, or yeah, carts ideally is what I'm going to recommend to reposition and move objects and reduce the weight of a load. For your station, reposition the work table to kind of eliminate that need for excessive reach. If your phone is pretty is far away, you want to make sure you want to bring that closer, so that you're not overextending, you're not reaching that far. You want to make sure you just kind of implement engineering controls to make sure you set up your workstation for success. Some examples like this, if you are using the phone routinely, one thing you can use is a headset, so that you don't have to constantly reach to pick up the phone. Your chair. If your chair is not ergonomically designed, it can cause back strain. It can cause, yeah, it can cause back strain. It can cause neck strain. So having an ergonomically designed chair with armrests and a backrest is ideal, or an ergonomically designed keyboard as well. These are examples of engineering controls that we can implement to kind of just set you up for that success. For your chairs, as I mentioned, you wanted your chair to be ergonomically designed ideally, but what that means is you want that the height of the chair is adjusted so that your feet are placed flat on the floor. You don't want your feet dangling off of the floor. You want your feet directly flat on the floor if they can. Using a footrest is acceptable. The important thing is that your feet are flat and your knees are kept at a 90-degree angle. With your armrest, I don't have armrests here that are adjustable, so these chairs are not great. But you want to have armrests that you're able to adjust, that you're able to move them up or down so that it kind of matches the height of your desk, and you're able to put your elbows at a 90-degree angle, kind of just have them neutrally. Essentially, when you're typing, you want to have your arms on the armrest so that the armrests are taking all the burden that you are putting on your arms. Go back. You also want to make sure that your backrest is adequately supporting your back, that you're able to rest on it. If not, then that chair may not be ideal. Or you can use a lumbar support pillow or just kind of a regular pillow to put that support on your lower back. But ideally, we recommend a lumbar support pillow. And when we do conduct the assessments, one of the things that we do look at is what kind of equipment we do have available or we can recommend to you. We do try to recommend something that is ergonomically designed. If your chair has an adjustable seat pan, you want it so that the seat pan is 2 to 3 inches from the back of your knees. And you want to make sure that your chair is pretty much locked in an upright position. You don't want to be able to like kind of swing your chair up and down. You want to keep it locked and stable. For your keyboard and mouse, you want to make it so you want to have them in an area where you're able to access them easily, where you don't have to like overextend to reach them. Your arms should be on the armrest and they should be able to reach the keyboard with keeping your arms at a 90-degree angle. Again, the armrest is doing all the work. With a mouse, you want to make sure that the mouse you're using is going to be the correct size for your hand. So you want to use a mouse that's large. A travel mouse is not ideal because it's significantly smaller. So you have to create that gripping motion. If you're gripping up, if you have this little motion, it's kind of like you're putting that strain on your fingers, you are going to feel it over here because you are actively, if you did this now, you're going to feel that you're actively putting pressure on your fingers to kind of maintain that position. And with your workstation monitor, you want to make sure that you're placing it directly in front of you. It should be about an arm's length away. If you extend your arm, you should be able to touch the screen. It shouldn't be further than that. It shouldn't be closer. If you're touching the monitor and your arm is like a little bent, you kind of just want to push the monitor back a little bit. That's going to reduce strain on the eyes. And another thing I always address and notice when I conduct ergonomic assessments is that the monitors are never below eye level, which is where they should be. So your monitors should be below where your eye level is, because when you are looking at your screen, you want to make sure that you are using your eyes to do all of the work. If your monitor is adjusted and higher than eye level, you're going to move your neck up. You're going to have to move your neck, doing that motion to kind of read through the screen. If your monitor is below eye level, your head's going to be at a neutral position. You're going to be essentially looking straight. Your eyes are going to be able to look down the screen as you're reading. You want to make sure that your monitor brightness is adjusted so that it matches the brightness of your surroundings. That's going to avoid straining your eyes. And if you do have multiple monitors, make sure that they're relatively at the same height as well. You don't want to have one that's short and another one that's very high up. Again, both of them should be kept below eye level. And this is an example of what an ideal workstation would look like. You want your back rested on the back support. You have 2 to 3 inches between the knees and the seat pan. Your feet are flat on the floor. Um, the shadowy figure in this picture is reading, looking down at the monitor, but their head is in a neutral position. And that's essentially what you want your monitor, your workstation to look like. You want your arms at that 90-degree angle using the armrest, your legs at that 90-degree angle. And also just keep in mind, I did say you want your feet flat on the floor, or you wanted to use a footrest. And it's one of the reasons is because every person is different. Every individual, it's going to be different, whether it's in shape, size, or ability. So that's something that we do take into account when we conduct an assessment. Every assessment is going to be different per individual, per workstation. One chair that we recommend for an employee may not be recommended for the next employee for a number of reasons. So we do take that into account, and we do make recommendations based on what the need is and who the audience is. And then kind of to wrap up here, and I want to thank everyone again for joining. We want to work on prevention with ergonomics and musculoskeletal injuries. Once you get the injury, you have the injury, but it can be prevented, and that's the goal here. The goal is to inform everyone on what ergonomics is, programs that we have here available, what to look out for, what you can do, and ways that we can start reducing the number of ergonomic injuries that we are getting at Penn State Health and across, all industries. So just remember they can be prevented. Listen to your body. If you notice any sort of pain, discomfort, numbness, tingling, any of those indicators, stop right away, address it, contact safety, and we'll set up an ergonomic assessment of the workspace and provide recommendations to you with that as well. And then one thing I did want to mention is that when we do conduct an ergonomic assessment, our main goal isn't immediately to start making recommendations of like, well, we recommend that you purchase X, Y, and Z. If there is equipment that is required, ideally what we try to do is we try to see if we do have something available with, locations leaving and with, labs clearing out or employees leaving and stations becoming available. Sometimes these devices become available to us, and if we do have them, we make them available to the employee at no cost, because again, we're here to prevent these things, and we're here to create a safe working environment as well. But again, if you have any questions, please feel free to reach out to me if you would like an ergonomic assessment, whether you're having any sort of injury or discomfort or not. If you would like to just have an assessment for prevention, please feel free to reach out. My email is there, as well as our safety main office number. But yep, I look forward to hearing from everyone. And if you have any questions about this presentation, I'm here to answer as well. Thank you.
Wonderful. Thank you so much. We actually do have one question in the chat box, and you may have kind of answered it a little bit there at the end. But this person asked, are we able to get ergonomic keyboards through Penn State Health if these are needed? If so, do these require a note from a doctor stating the need?
Thank you. You do not need a note from the doctor to get an ergonomic keyboard. I feel like I've gotten that a lot lately with employees asking if they need to bring a note for the ergonomic assessment. And no, if you would like an ergonomic assessment, you don't need any sort of note. If we are going to recommend any sort of supplies or any sort of equipment, a note isn't needed for that either. For ergonomic keyboards, as I mentioned, if we do try to see if we do have anything available, and if we do, we'll happily provide it. But in the event that we don't have them available, I know they can be purchased through the purchasing department, and I do have that information that's also included in the assessment as well. I hope that
Wonderful.
answers that question.
I think so. Another one, do you do assessments for work from home employees?
Yes, we can do a Teams virtual assessment. I do ask that the employees do have their camera on because I do need to see what the workstation looks like. But there are a lot of employees that work from home, so that is an outreach that we also do. We can schedule a Teams meeting to do that virtual assessment.
Great. Any other questions? I see a comment here about an outpatient clinic that I can send over to you about some of the things maybe to look at that specific clinic. So,
I see that. Thank you. That'd be great.
great. Any other final questions? I don't see any coming in. Well, Andre, thank you so much. That was a great presentation. A lot of tips and tricks, small things, big things that we can do to incorporate some better ergonomics into our workstations. I see some thank yous. Somebody said that they didn't even know you offered this, so that's great. Feel free to utilize our Penn State Health safety teams services. They're great. I learned a lot. I hope you all did too. And so with that, I thank you all for joining. Andre, thank you for your time. And we will see you next month at our November 19th Lunch and Learn. More information to come in the follow-up email.
Great.
All right.
Thank you, everybody.
Thank you.